Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about periodontitis. So if you like the video related to my health, my way, I would like to request you all, please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Periodontitis is a chronic inflammatory disease initiated by the presence of a bacterial biofilm called dental plaque, which affect both the periodontal ligament and bone surrounding teeth. In the last decade, several lines of evidence have supported the existence of a relationship between periodontitis and systemic health. For instance, as periodontitis act within the same chronic inflammatory model seen in cardiovascular disease or other disorder such as diabetes. Several studies have suggested the existence of bidirectional link between periodontal health and these pathologies. For instance, people with diabetes are more susceptible to infections and are more likely to suffer from periodontitis than people without this syndrome. Analogously, it is now evident that cardiac disorders are worsened by periodontitis both experimentally and in humans. For all these reasons, it is very plausible that preventing periodontitis has an impact on the onset or progression of CVD and diabetes. On these grounds, in this review, we have provided an updated account on the current knowledge concerning periodontal disease and the adverse effect exerted on the cardiovascular system health and diabetes, informing reader on the most recent preclinical studies and epidemiological evidence. The first is introduction about it. Periodontitis is a multifactorial chronic inflammatory disorder that can lead, if untreated, to the non-reversible damage of supportive tissue, periodontal ligament, cementum, and alveolar bones surrounding the teeth with consequent tooth loss. Importantly, one of the major determinants of the development and progression of periodontal disease is represented by an increased concentration of pathogenic bacteria within the dental plaque that activates a massive noxious immune response. For instance, the augmented concentration of bacterial surface molecules such as lipopolysaccharides stimulates the production of inflammatory mediators and cytokines that in turn promotes the release of the matrix metaproteinases, these tissue-derived enzymes that participate in the extracellular matrix remodeling and bone destruction. Importantly, recent studies have clearly proven that these deleterious effects are not only restricted to the oral cavity but can affect the overall health of an individual. For this very reason, research involving the systemic implication of periodontitis has grown exponentially. Indeed, periodontal pathogens can destroy the epithelium of the periodontal pocket, thus allowing the entry of noxious endotoxins and exotoxins into the bloodstream. This process leads to bacterial dissemination and systemic infection with a consequent rise in inflammatory response. For instance, periodontal pathogens have been detected in disparate tissues and organs of the cardiovascular system, including human cardiac tissue, pericardial fluids, heart valves, and in atherosclerotic lesions. That is, for this reason, in the last decades, periodontitis has been associated with the onset of systemic disorder, including cardiovascular disease and diabetes. In this regard, two meta-analyses by Jankett et al. And Koff-Hatter and colleagues respectively have evaluated the potential correlation between oral disease and CVD, concluding that periodontal disease is a potential risk factor for cardiovascular events such as stroke and coronary heart disease. Furthermore, it has been previously demonstrated that individuals with periodontitis have a sensible increased risk of developing CVD, including myocardial infarction, heart failure, peripheral artery disease, atherosclerosis, and stroke. Interestingly, the link between periodontitis and diabetes has also been pursued. Several studies suggest that this association is bidirectional. Indeed, individuals with diabetes are more likely to develop periodontitis, and those subject with periodontitis and diabetes present a worse glycemic control. Therefore, based on this premise, it is of paramount importance to inform health professionals about the consequence of disease affecting the oral cavity, in that these are potentially associated with a range of pathologic conditions. Thus, the aim of this review was to update clinicians and basic scientists about the current evidence, experimental and clinical, that support the existence of the relationship between periodontal disease and CVDs. The second part, pathogenesis of periodontitis. An imbalance of microorganisms forming the dental plaque is a major triggering factor for chronic gingivitis and periodontitis. In addition, periodontitis is associated with and probably caused by an altered dynamic interaction among specific subgingival microbes, host immune responses, hazardous environment exposure, and genetic factors. To date, almost 800 different species of bacteria have been identified and characterized in human dental plaque. Of relevance, the putative pathogens include gram-negative and positive members such as Treponema, denticola, Tannerella, forsythia, Prevotella, intermedia, Agregatibacter, actinomycetemcomitans, Campylobacter rectus, Eubacterium, timidum, Parvimonas micra, and Porphyromonas, gingivalis. Mechanistically, infections usually lead to gingival lesions with contamination of tissues surrounding the teeth. Then the lesion progresses to periodontitis once bacterial infection and the subsequent inflammatory response tackles the root surface, penetrating the supporting structure of the teeth. In general, the inflammation process begins with phagocytes, that is, neutrophils and macrophages, that migrate to the lesion site. Importantly, this process is at least in part promoted by the gingival epithelium that release chemical mediators including interleukins, prostaglandin, tumor necrosis factor alpha that recruit neutrophils. Furthermore, these phagocytic cells express on their plasma membrane specific receptors that recognize and bind surface molecules of bacteria. Analogously, the plasma proteins of complement system react with one another to make pathogens more susceptible to the action of these phagocytic cells. The function of this initial response include the killing and elimination of microbes, followed by an efficient clearance of the resulting cellular debris. Necrotic tissue and apoptotic. By mononuclear cells such as monocytes and macrophages, it is worth stressing that is an effective and healthy immune system. There is no damage to the tissue surrounding the tooth, and the bacterial insult is efficiently removed. The third part, diabetes and periodontal disease. Diabetes mellitus is a clinical syndrome characterized by hyperglycemia caused by inherited and or acquired deficiency in insulin production and or action. Importantly, an association between DM and periodontitis was reported in the literature dating back to the 1960s. Since then, several reports have clearly demonstrated an association between DM and periodontal disease in both animal and human. For instance, in animal studies, Blasco, Beck, and co-workers recently provided data supporting the role of periodontal dysbiosis in the development of insulin resistance. Moreover, Liu and co-workers demonstrated that periodontal disease aggravated pancreatic beta cell failure and insulin resistance in diabetic mice. Importantly, evidence in humans has demonstrated that treating periodontal disease is able to reduce glycated hemoglobin in diabetic patients. Furthermore, a recent observational study performed in subjects aged 40 years or over demonstrated that periodontitis was significantly more prevalent among individuals suffering from diabetes than non-diabetic ones, with no difference in terms of gender and age. The specific mechanism connecting DM and periodontal disease has not been fully elucidated yet. If not, several reports have suggested that DM participates in altering the subgingival bacterial community through substrate related alteration, offering a microenvironment favorable for the pathogen's growth. Furthermore, systemic levels of inflammatory mediators, including C-reactive protein and IL-6, which are elevated in periodontal disease, may represent the linchpin between DM and periodontitis. For instance, in 2010, Shenley and co-workers provide data showing that periodontitis correlated with increased levels of glycated hemoglobin and CRP observed in DM patients. Periodontitis as a risk factor of cardiovascular disease. In the last 2 decades, several studies have shown that individuals with periodontitis are at higher risk of CV events, including myocardial infarction, peripheral artery disease, stroke, and heart failure. Myocardial infarction and periodontal disease share several common risk factors, including diabetes, smoking, and inflammation. For this reason, a growing body of evidence suggests that periodontal disease is associated with increased myocardial infarction risk. Of note, in the 1980s, Matella and colleagues observed that dental health was significantly worse in patients with myocardial infarction than healthy control. 20 years later, Shawson and co-worker demonstrated that there was a strict association between chronic dental infection and acute myocardial infarction. Further to this, Johnson and co-workers suggested that oral disease could be used as a risk indicator of death due to CVT. So that's all about the diabetes in this video. I hope you all liked it. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved one so that they will get to know better. So this is Gary Anderson signing off. We will definitely meet in the next video with my another content. Till then, God bless you. Bye bye and take care.